Mastectomy and immediate single-stage skin-sparing mastectomy is a relatively new procedure. For the past 50 to 60 years, we've relied on primarily two paths following a diagnosis of breast cancer. The first traditional path was a modified mastectomy where the skin envelope, as well as the nipple and areola and breast tissue, was removed. The reconstruction following this more aggressive procedure would either require a flap procedure or the placement of an inflatable balloon or tissue expander in order to expand the skin over time for the eventual placement of a prosthesis. The second path is the lumpectomy and radiation technique, whereby the cancer itself is directly removed and followed by radiation of the treated area. We found this procedure to be less disfiguring. However, the side effects of lumpectomy and radiation have been significant amount of radiation damage to the overlying skin. And some studies indicate that there may be as high as a 10 to 12% recurrence rate of the breast cancer. There's a new path which has been developed over the past 10 years. I've personally been using the skin-sparing mastectomy with immediate breast reconstruction for that period of time. We have to ask ourselves, first of all, who are the good candidates? Who are ideal candidates? Number one, just about everyone is a very good candidate for single-stage breast reconstruction. However, those with more advanced cancers would probably be better served with the traditional mastectomy. Also, candidates for this procedure would be patients with an early stage breast cancer with the cancer not being located near the nipple or near the skin. The third candidate would be those patients that don't have a definitive diagnosis of breast cancer, but have an extremely strong family history of breast cancer and may be genetically predisposed to developing a breast cancer at a later date. The benefits of the single-stage skin-sparing mastectomy are, number one, it is much less invasive. Number two, all of the breast tissue is removed, unlike lumpectomy and radiation. And that gives the patient, I think, more peace of mind, as well as the general surgeon performing the mastectomy. Three, I found in my 10-year experience, there's a much better cosmetic advantage and result using the skin-sparing mastectomy and immediate reconstruction. Four, there's a much faster recovery following this single-stage procedure. And five, I found less of a chance for a need for revision in the future when using the skin-sparing technique. Traditionally, the path that we go down or the patient proceeds with is as follows. A diagnosis of breast cancer is made. We determine the extent or the stage of the breast cancer. If the patient is a good candidate, then she's scheduled for the mastectomy with skin-sparing technique. As a team, myself and the general surgeon performs the skin-sparing mastectomy with removal of the breast tissue and evaluation of the lymph nodes if required. During the same procedure, I will then reconstruct the breast mound with a prosthesis and probably immediate reconstruction of the nipple at the same setting. Operative time is usually 3 hours, and the patient usually requires a 24-hour overnight hospital stay.